What's up, guys? How's it going? Cade Moore with More Muscle, and today we're going to be talking about meningitis. Guys, meningitis is inflammation in the brain and in the spinal cord. Meningitis can be caused by bacteria, a virus, fungus, in the cerebral spinal fluid. Guys, there's the viral meningitis and there's the bacterial. Bacterial, guys, remember that is very contagious. Viral is not. Then we got, guys, some expected findings are photophobia, where you're like, it hurts to look at light, vomiting, irritability, headache. And for newborns, you might not see any, symptoms, but you can see some manifestations such as, poor muscle tone, weak cry, poor suck, refuses feeding, vomiting or diarrhea, possible fever or hypothermia, nuchal rigidity, bulging fontanelles, and to three months to 2 years old, you might see seizures, fever, irritability, possible nuchal rigidity, poor feeding, vomiting. And for 2 years old, you're going to see about the same stuff, and except you're going to see, headache, vomiting, irritability as well. So guys, this can be caused from not getting vaccines, not taking care of your health, and not something you want to have. What you'll do for this, guys, is there's a lumbar puncture. And lumbar puncture is where a baby or newborn will sit on their side, and they'll basically have some cerebral, there will be, collection of fluid, the spinal fluid, and we'll analyze that. So what you want to do is have the client void before procedure. You want to put some anesthetic cream like lidocaine on their back 45 minutes to an hour before, because it's going to be painful. And that lidocaine is basically a pain, it's a pain pill to that certain area, and it's going to cause pain reduction. You can also give them fentanyl or other, pain pills, and you'll get that. And then after, you're going to monitor for bleeding, hematoma or infection, guys. So anytime there's surgery, an infection is very important. So you want to monitor their temperature consistently to make sure they don't have a fever after any type of surgery or any type of, lumbar puncture or whatsoever. The next thing is you want to keep the bed in a flat position. So there's high folders where, the head of the bed is slightly tilted up. And there is this where you want the bed straight, completely straight. But anyways, you want to make sure to activate droplet precautions, guys. Droplet precautions is a gown, a mask, gloves. It doesn't have to be one of the high-tech masks, just a surgical mask. Airborne is where it's the high-tech mask, I think 95, whatever it's called. But anyways, droplets, just the surgical mask, gloves, and gown. You want to maintain respiratory isolation, monitor vital signs, monitor urine output, fluid status, and you want to make sure that this condition is getting better and not getting worse. And obviously, you want to keep them away from bright light because they have that photophobia. You want to keep them cool. You want to position them, make sure they're comfortable, and inform the family, obviously, of the client's condition because this is usually a baby. And you want to administer IV antibiotics for bacterial infections. So if it's a viral infection, would you administer antibiotics? No, because it wouldn't work. So guys, a lot of people take antibiotics for viral infections, which is extremely dumb because it will kill off all your good bacteria, and then it might even make you even sicker. So only take antibiotics if it's bacterial, right? And then you'll obviously do, you want to, you can administer corticosteroids, which are a steroid that helps with inflammation. There's that brain inflammation, and you want to keep that down. The more inflammation, that can increase the intracranial pressure in the brain, and that can cause, problems. You can use acetaminophen with codeine to relieve pain and discomfort. And you want to make sure patients get immunizations because if you get this HIV or PCV vaccines between the 2, 4, and 6 months of age, and then again at 12, that can, help prevent meningitis. And then, guys, so the biggest complication is increased intracranial pressure. because this could lead to neurologic dysfunction where they can't think properly. Neurologic is brain, dysfunction is, brain's not working correctly, right? And you want to monitor for increased ICP, so that's intracranial pressure. And yeah, you want to look for bulging or tense fontanelles, high-pitched cry, distended scalp veins, irritability, bradycardia, so slow heart rate, and respiratory changes. And for children, you want to look for increased irritability, headache, nausea, vomiting, diplopia, that's like a vision problem, seizures, bradycardia, and respiratory changes. Provide interventions to reduce ICP. So that's like positioning them right. Avoid coughing, because when you cough, that can increase your intracranial pressure. Straining, that can also increase it. Bright lights, you want to minimize environmental stimuli. So you want to lower the stimuli so they can relax and their blood pressure can go down and that ICP can go down, the intracranial pressure. So anyways, guys, that's for meningitis. You want to make sure you're healthy. You want to take your vaccines. And you definitely want to, do proper hand hygiene and prevent yourself from getting sick. So that's meningitis, guys. Thanks for watching.